Assalamualaikum and hello everyone. I'm Arfa Yunus and you're watching NST TV. So in the studio with us today, we have two guests. The first is Dr. Kiro Bakaran. He's a general and breast endocrine and bariatric surgeon in the Gleneagles Penang with a special interest in managing people with obesity. And our second guest is Dr. Alexander Tan. He's a consultant endocrinologist in Sunway Medical Center and he has done research in the fields of obesity, and that is exactly our topic for today, obesity. So firstly, I would like to start with Dr. Kiro. We'd like to understand what is obesity, how do you define it?
Thank you for having me, Arfa. Obesity is defined as the excessive and increased accumulation of fat in the body that results in impairment in the normal conditioning of the body itself. So it can cause serious medical conditions to that individual. So it's very important for us to understand the causes of obesity and to take steps to try to overcome them.
Yes, true. And Dr. Alex, how serious is it, obesity? I mean, what are the health implications of obesity?
Oh, I mean, there are plenty of implications. Obesity can affect you from the top of your head all the way to the bottom of your toes. Just like what Dr. Kiro said. It's when you have too much fat in your body, all right, and that leads you to have medical problems as a result. It's not just like, oh, I'm a bit fat, but it has got health implications. So the common ones that most people know about: diabetes, high blood pressure, okay? These, of course, are high cholesterol levels. These, of course, can lead on to other things as well, like stroke, heart attack, okay? But obesity is also beyond that. There are other effects that people may not necessarily think about. There is a syndrome called the obesity hypoventilation syndrome, where you can't breathe enough at night for the sheer simple reason that you have too much fat in your neck, too much fat in your chest, your lungs can't breathe properly, the air can't get through your throat properly, all right? Then you don't sleep enough. Then when you don't sleep enough, it has so many psychological effects. You feel tired, you have to take MC, etc. Okay, there is also risks towards cancer. There are certain types of cancer which is increased as a result of you having obesity. Okay, and that, of course, nobody wants to have cancer. It can affect your fertility as well. So if you have obesity, your chances of getting children, becoming pregnant, etc. It can affect a woman's menstrual cycle as well, right? There are also effects of obesity on just having sheer weight to your legs. So people with obesity have higher incidences of knee pain or arthritis as well, right? So obesity can have lots and lots of negative effects. If you want to know whether you reach a cutoff for obesity, because sometimes it's difficult to see whether, oh, you know, am I having this excess amount of fat that leads to all these medical problems. There's no perfect way of trying to give a cutoff, but for Asian people, most of the time, we tend to define overweight as having a body mass index of above 23 kilograms per meter squared. And if you are above 27.5 kilogram per meter squared of this BMI, body mass index, then you're classified as obese.
How about in Malaysia, doctor? How are patients with obesity being managed in Malaysia? At the primary care level and also at the secondary care level? Maybe Dr. Alex?
Yeah, I mean, I think just back to the basics, I think sometimes in terms of management, we have to understand that there needs to be an identification of it as a problem. Sometimes it's very easy for doctors to sort of say, you know, okay lah, he's overweight, but he has come to me for something else, so perhaps they don't really directly manage that. They see the high blood pressure, or they see the fact that this person has got a high sugar level, diabetes, or a high cholesterol level, but perhaps sometimes need to look at the underlying problem, which is the obesity. So sometimes the management could be better, all right, in that we need to identify these individuals. In terms of at the primary care level, I guess there is research actually to say that if a doctor actually identifies and tells a patient, sir, your weight is a problem, all right, that has got real effects, okay, because many times patients go there sometimes may be an element of denial lah. You know, if the doctor saw me for my cough and cold, but he didn't say anything about this, I should be okay, right? Yeah. So I guess that's one of the things that I would like to drive forward as well. That if you do, see a patient who has, for us as medical professionals, if we do see a patient, we do need to speak out and voice out in the first place. The second part is perhaps on the side of the patient as well, okay, to sort of understand that, look, putting on weight can happen gradually over time, and it's okay to put on some weight, but as what Dr. Kiru said, once it becomes unhealthy, once it has an impact on your sugar levels, on your cholesterol levels, on your blood pressure, on you getting arthritis, on you not sleeping properly, you having risk in the long term of cancer, then you need to do something about it.
True.
In terms of treatments, I tend to use, on a very simple level, 3 things that patients can sort of do before they reach secondary care. So the first is food, right? Because that's a very, very big element, right? Malaysians, we eat everything all the time.
Yes.
Yeah. So food, you need to cut down on the amount of foods, and you also need to understand what foods you can perhaps eat more of and what foods you really, really need to restrict and cut down upon. So that's one thing. There are healthcare professionals like dietitians that can help with that. There are many websites, there are many apps even nowadays that can help you to identify these foods. The second thing would be activity, as in physical activity. So if you exercising, if you go out and purposely join a gym, play some sports, play some badminton, or even what we kind of do as incidental activity. So walking more in a shopping center, using the stairs instead of the lift, those will also kind of help. The third one is not often mentioned, but I think one of the drivers of obesity, and that's why this is also a complex disease, is that we need to sleep enough. A person who doesn't sleep enough will induce certain types of hormones. These types of stress hormones can actually cause you to put on weight. And this is the kind of put on weight where you don't have to do anything except don't sleep. And that's an aspect of it. And finally, I said these are 3 things that you can do, okay, on your own. And finally, there will be the last one, which is treatment. And if you view obesity as a disease, not just somebody's a little bit fat, but if you view it as a disease, then you need to get treatment. And in terms of treatment, there is drugs that we can give to help, okay, but there's also surgery which can be done to help in some cases.
Got it. And what are the treatment options available to help adults manage obesity, Dr. Kiru?
Yeah, so currently I think the base of all treatment strategy to manage obesity has to come from lifestyle change, because I think essentially that's the most important part. If you do not take proactive steps in changing your lifestyle by controlling your behavior, managing your diet, having a more active lifestyle, then the secondary level management options that you have is probably not adequate enough. So if you've already decided to lose weight, then probably it's good to meet a healthcare professional to direct you in the proper path. So in taking steps in making sure that your diet intake meets the caloric demand that you actually need. So you got to assess your body composition and so on. And of course, being active is a very important thing. Like I think today, Arfa, it's raining out there. So not many of us can actually go out and enjoy a wonderful walk in the park, or a jog. So these are some limiting factors that that affects us, and not many people can actually afford to join a gym and so on. So if individuals take steps to try to overcome these limitations, then of course you'll have a very good foundation on lifestyle change. The next step that you can add on is, I think Dr. Alexander also is quite familiar with adding on to anti-obesity medication to try to curb your appetite, steps to curb your appetite, increase your metabolism, and of course to actually excrete probably your increase your fat metabolism so that you actually bring out fat from your body. So there are different types of medications that can be targeted to achieve this weight loss objective that you have. The next step would of course be in terms of a surgical procedure. So in surgical procedures you have those which are non-anesthesia like procedures, that is by placement of the intragastric balloon, and of course you have surgical procedures which rely on anesthesia. So I'll talk about the intragastric balloon, where you can actually place a balloon into the stomach, either endoscopically, or currently we have a balloon that you just need to swallow, and it goes in and then you inflate with about half a liter of fluid inside, and it forms a restrictive mechanism that limits you from being able to eat. So you can actually control your appetite. And the next step,
interesting.
Yeah, it's quite interesting in terms of, but we have different types of balloons that achieve this. Some can be placed for about 4 months, some can go up to about a year, and the mechanism is purely restriction. Again, they do not work individually, they actually need to be in combination with the lifestyle change, because this is where the concept as a total approach actually makes sense. Similarly with surgery as well, you have surgical procedures that go for restrictive type of procedures where you cut the stomach and you actually limit the size of it. By doing this type of surgical procedures, it's not just by cutting the stomach and restricting the amount that a person can take. There are actually hormonal implications that actually take part. For example, like we have this hormone called ghrelin that is produced at the fundus, which is the top part of the stomach. So by resecting that portion, the hormone ghrelin in your body actually comes down. And it's been shown by research that actually it maintains for about 1.5 to 2 years. And this hormone is really important for us to feel hungry. So can you imagine, Arfa, that you're actually going around and it's towards the end of the day and you actually don't feel hungry.
So that's amazing.
Yeah, so this is the magical point of undergoing surgery, because it gives you another beneficial hormonal adaptability that actually improves and makes your weight loss more lasting. So weight loss surgery can actually keep you off the weight for a certain amount of time and maintain it in the longer duration as well. But of course, not everyone can go for surgery, because we have to be very selective, and individuals who are really worked up, by Dr. Alex and myself, then when they find that actually they are fit for surgery and so on, can be offered that as a treatment option.
So all of these treatments, are they easily accessible? And if not, what do you think are the access barriers or and gaps?
Okay, actually the methods for weight loss are available in Malaysia right now. In fact, they've been available for the last 5 to 10 years. I think the most important thing to me is the barrier in terms of knowledge and in terms of awareness. So my personal opinion is that probably Malaysians as a whole do not understand that obesity is a disease, like what Dr. Alex said earlier. If we understand that currently flu, diabetes is a disease, then we should also be able to understand that obesity has its own signs and symptoms, and it does also cause impairment to the body. It affects your knees, it affects your, in terms of metabolic conditions like diabetes and OSA and so on, like what Dr. Alex said. So if we understand that it's a disease, then I think people will understand more that they have to take proactive steps to try to manage their own health and so on. So that's my opinion on that.
Dr. Alex, what do you think that can be done to improve the diagnosis and treatment management of people living with obesity?
Yeah, so I completely agree. I think the first thing is we need to understand this is a disease. This is not just, he's a bit fat, looks chubby, looks cute. But if you look beyond that and see that this person is either having already or is at high risk of getting all these other problems, issues like diabetes, high blood pressure, etc., all those things that I've said, issues with fertility, issues with earlier death, issues with higher risk of cancer, issues with their joints, etc., then you need to try to treat that person. It's treatment, you know, it's a disease. I think that's important for healthcare professionals to recognize. That's also important for patients to recognize, not deny, and perhaps accept as well. Because if you don't view it as a disease, a problem, then it's easy to not be treated. Now, other access barriers is an interesting fact, is that many insurance companies view the types of treatments that I give and Dr. Kiru, for example, give as being cosmetic. So they don't recognize obesity as a disease. If you were to be admitted to my hospital, for example, and someone does a obesity treatment surgery, it would most likely not be covered by insurance. If I were to give medications to bring down the weight of this individual, it would also, again, most likely not be covered by insurance. They view it not as a disease, but as perhaps something cosmetic. But it's not. It's a real health issue, because right at the definition is this thing causes you to be sick, right?
Yes.
Yeah. So those are one of the things. Cost is, of course, also an issue. No surgery is cheap. Right?
True.
No surgery is cheap. And there are many things that need to be in place as well, right? That need to be screened through. There are blood tests, imaging, etc. You know, X-rays, scans, etc. that need to be done to prepare individuals. So again, that also may be something that if we can find ways maybe to bring down the cost of these things, to make things more accessible to patients who need it the most. I think further down the line, if people view it as in, if I invest this money now in making myself healthier, right, then I live a better life, and I don't spend the money later on when I have a stroke, or I don't spend the money later on when I have a heart attack. You know, I don't spend the money later on when I need to have operations on my knees, you know, to this one. And if you look at it, it causes all these things. And if you just treat that thing, you bring down the person's weight, right?
Yes.
You prevent so many things.
Yeah, true.
It's always difficult when you talk about prevention, because it's like a person who has knee pain, he knows he has knee pain, and you can treat that. But you know, if you could reverse back 20 years and do one thing that would have prevented the knee pain, but at the same time reduce your risk of a heart attack, at the same time reduce your risk of stroke, etc., then you know it is actually cost effective. But maybe you know we do need to see it not just as a like oh, he's a bit fat lah, you know, but as a disease. I think that's an important aspect to this.
All right. And there are many campaigns about obesity, but despite all these health campaigns, we still see a high prevalence of obesity in Malaysia. So what do you think that we can do to better address this, Dr. Kiru?
First thing, I think I must congratulate all the parties who are taking steps in doing a wonderful job in trying to overcome this global obesity epidemic that we are facing. I'm sure there's a lot already done, but there's a lot more that we can do. And I think maybe the focus point, like what Dr. Alexander was telling, right now our main focus in our medicine approach in Malaysia is actually to target the effects of what is happening. That is the diabetes and the renal failures and so on. But like you said, I think maybe we should target the prevention. So let's address obesity in schools or in primary care levels. You know, maybe in housing areas, create more facilities for families to enjoy weekend in the park and so on like that. So I think these steps may seem very minute, maybe very cheap in cost, but I think it's pretty effective. And perhaps that's the target that we should go. Because I think by spending a lot of money in doing one campaign one day in a year, we spend a lot of money, we spend a lot of on advertising and so on. You know, we have a lot of booths, you know, a lot of campaign, jom this and that. The effects are there, of course, but I think it's very short lasting. And it's not sustainable in the long term. And I think once it happens, the event is over, then people forget about it. So I think we should do something in a more sustainable manner, more prolonged. Yes.
Okay. Dr. Alex, so
Yeah.
where do people who are overweight or obese can go and seek help? Because like you mentioned earlier, there are some who are in denial. So how and where do they go to seek
Okay.
help?
So I guess, yeah, the first port of call would be your general practitioner or your doctor. Okay, he can perhaps recommend some medications and perhaps also suggest certain things, changes that you can make to your diet. Okay, he may refer you to a dietitian, somebody who can help to plan out your individualized diet for you, because no two people are the same. The makcik who comes from a kampong who's obese versus the urban high-flying CEO executive who flies to 7 different countries a week is also going to be a different creature, right? So your primary care practitioner, if you approach him and say, look, I'm having these problems, okay, can help as a first port of call. There will reach a point sometimes where you do need help beyond that as well. So the dietitian, your main doctor, someone who's an exercise specialist, whether it's in the gym or whether it's a certified fitness trainer or physical trainer or even a physiotherapist. But sometimes beyond those things, you will need a hospital type setting. And in a hospital type setting, there are certain other medications that we can use. There are techniques and ways that we can help to actually count the calories, admit you, okay, and plan out a diet for you in the ward to help with some initial weight loss. And then, of course, at the end of the journey, there is also these surgeries that Dr. Kiru performs as well. So those are also other things. But I also wish to echo what he says. I think the first step is not being in denial. And I think also, in addition to it, I see this as being, it's a global problem, and it's a problem on so many layers. It's a problem on a governmental layer, right? Because the government needs to look after, needs to provide for healthcare, you know. And if you have a workforce which is too obese, cannot do work properly, etc., that's a problem. But there's also aspects of it which are also cultural as well. When I want to make friends with somebody new, I invite him to eat. And even when he's full, I force him to eat some more, right? Hey, if you don't finish eating, it's
I will merajuk, you know.
Yeah, I will merajuk, you know. But perhaps we need to change that kind of background and sort of say that, look, oh, okay, if you're full, maybe let's talk, or let's just have a nice drink or something like that, which is not you know, going to increase your weight. Yeah, and not force people to sort of you know, feel obliged that they need to eat. Then there is a societal kind of impact as well. We all like to feed our children, all right? And we need to realize that it may reach a point where it becomes unhealthy, and there needs to be a degree of education for the next generation, as in whether you eat an ice cream or whether you eat a bun, okay, what is the difference in terms of how it will impact your health as well, because you know, it starts from young, these habits as well. So and there are physical impacts as well, in the way, as you said, your roads are designed, your tamans are designed. You know, if you coop everybody into as dense as possible with no play areas, right, with no walkways, you make it you know, if it's unsafe for a person to go and exercise, what are some of the issues surrounding that? And also perhaps maybe also to make it easier for them to bring up this problem, right? We've had campaigns for men to say, look, don't be shy about you know, coming out about erectile dysfunction. But also perhaps don't be shy to sort of say that, look, I have a problem with my weight. I want to do something about it. And also training doctors to say, okay, well, this is the pathway. There's a set pathway for you to sort of say that, oh, okay, you've identified now, or I have identified you as having a weight problem, but here's what we can do about it. I think that will help also. So there are actually many things, you know. And maybe one word I would also like to say is sometimes it's a bit, to do with choice as well. People choose sometimes to do unhealthy things like smoke. And I guess on a government level, there are ways that you can increase the price of cigarettes, make sure that it's not sold in places where teenagers hang out, for example.
Yes.
So in the same way, we need to work with government as well to sort of say that, look, what are some ways that we can help to curb obesity in the same way that smoking is discouraged. People still have a choice. If you wish to eat, you know, excessively, right? It is a choice, and if you wish to you know, be that way, it is a choice. You have to understand the implications of it, but perhaps there are ways that we can discourage it as well. Yeah.
Dr. Kiru, maybe you have something to add?
Yeah, I think another place where you know, a common person probably would like to find out details on weight loss and so on, they turn to look a lot into the internet or into social media and so on. So I think the presence of certain, especially weight loss drugs that are available there, which are not regulated, and of course slimming pills and slimming centers. There's a lot of things going on.
Yeah.
In fact, I think, you know, we'd agree this is probably a million or $1 billion industry. So, but I think most important for the patient to understand that this is something that deals with their safety, their lifestyle, and their health in general. So I think they should take proactive steps to find a better, reliable source or a institution that can actually cater to the whole holistic approach in taking care of them and managing the obesity level. So places like where Dr. Alex and myself work, we have a multidisciplinary team, and I think that is the way to go forward nowadays, where we have a dietitian, we have a physiotherapist, we have an endocrinologist, surgeon, all of us sit together in the same center, and the patient is in the center, and we work around them, and we provide a therapeutic approach that is catered individually for the patient. And I think this is the most advanced and as well as the most sustained level to manage and maintain weight loss that is longer lasting. And I think that is a better approach for patients. The problem is that they are not aware about this option that's available. And I think by us coming out and sharing this information with the public, probably they will be more empowered.
Yes, hopefully. And there you go. There are many helps available. So if you are overweight, please seek help for the sake of your health. Dr. Kiru and Dr. Alex, thank you so much for coming here today.
Thank you so much.
And that's all from me. I'm Arfa Yunus. This is NST TV. Good day, everyone.